In this session, we discuss systemic failures in crisis response, centering community experiences, and the relational context of distress. Welcome to the After Podcast. I am Naveed Zamani and I am your host. In this session, I'm excited to be speaking with Monica Sesma-Vazquez, Tara Collins, Fakih, and Anna Fetzer. Monica Sesma-Vazquez, PhD, is an assistant professor and coordinator of the Couple and Family Therapy program at the Faculty of Social Work, University of Calgary. Part of her research program focuses on transforming crisis response field from systemic, relational, and decolonial frameworks. Tara Collins, PhD, is an adjunct professor and research project coordinator at the Faculty of Social Work at the University of Calgary. Tara is a sessional instructor and has 20 plus years of practice experience. Fakih is a clinical social work graduate student and community practitioner focused on rethinking how mental health and crisis support are delivered to refugee and ethnocultural communities. Drawing on community-engaged and decolonial approaches, her work bridges research and frontline practice to challenge dominant models and advance more relational, culturally grounded forms of care. Anna Fetzer is a Guatemalan physician with a master's degree in psychiatry. She is currently completing a Bachelor of Social Work at the University of Calgary. Her experience includes providing inpatient and outpatient mental health care, supporting newcomers and refugees, and working with individuals experiencing trauma related to sexual violence. Thank you all for joining me today. This season, I've been asking interviewees for a story about a time in their clinical practice that they feel they failed and what they learned. And I'm so pleased to have a group of you here. Where does it make sense to kind of hop into that question?
Thank you, Naveed. I can start, and if you want. So thank you so much for inviting us to this podcast. I like your question when you say how we have failed, and I would like to speak as a supervisor, as a person that has been training systemic family therapists and clinical social workers, practitioners in general, and how to work with families and individuals. And I sometimes think that I have failed as a supervisor in trying to understand what will be the best when training future practitioners. And I can give you some examples. So sometimes I have two lives, right? When I'm training in crisis response, then I was trying to train in safety planning, risk assessment, those pieces. And when I'm training in family therapy, I think I was mostly trying to have different conversations about suicide or interpersonal violence or any other crisis in the families. I was trying to support the students how to have those conversations, maybe mostly focus on family interactions and meanings and how they coordinate actions to that. So I think the way I see that I was feeling is almost like I was, instead of connecting these two worlds and doing better bridges between frontline practitioners supporting crisis and all therapeutic work. And that also, in a way, in 10 sessions, supporting conversations about suicide or domestic violence, etc. I was thinking almost like it was like two different kind of trainings instead of these two areas communicating better and working together. I thought, for example, in the field of crisis response, it was needed more a systemic relational lens, and when we were training in crisis response or crisis intervention, and the same when I was supervising or training people to long-term therapy, I also thought that a little bit of better tools, skills on how to support in crisis was needed. So I think I was failing in that, if you tell me, and now with what we are doing together as a team, I think I'm trying to repair that failing piece and trying to communicate these two worlds better.
Thanks for sharing that, Monica, and I appreciate your openness. If I could just clarify, are the two worlds, if I heard you right, were kind of frontline work and kind of the crisis response world, and then like this other therapy, maybe like slower, longer term thing? Did I hear that right?
Yes,
And then
yes,
somehow in the intersection of those two things, as you're trying to support maybe connecting those worlds, was the failure as a supervisor? Did I understand that correctly?
yes. I thought like the frontline people needed to read more or be better trained or equipped with systemic and relational ideas. Like many of the contributions of family therapy, I thought like why we are not using those pieces here in frontline crisis response. And but at the same time, as someone like also focus on risk assessment, uh, like more focus on crisis interventions, how we also in the long-term therapy, like when I was supervising the students and a client was in crisis, I thought like something was missing there too, that we could also learn from the crisis intervention field.
Mm,
Many people might not connect this because they might say, but crisis intervention is not therapy. So maybe we are doing different things, or maybe these clients should reach out to helplines, and but not necessarily to me. Many therapists might wait between session and session and just provide resources to their clients saying, oh, between today and 2 weeks, if you have a crisis, call 988 or do this or do that, but not necessarily. And that embracing that they might be also in need of supporting in different ways those moments of crisis.
mm. It's an interesting question to wonder the distinction, or maybe like, yeah, how to discern between, well, maybe not discern, but like kind of this broader philosophical question of what is a crisis case and what's a therapy case, and kind of what's the connection in the work, and maybe what are the distinctions. And I imagine folks who have been in either context can maybe quickly or readily speak to it. But I think Monica, as I'm hearing that there's something about the training and supervision context where perhaps there's more epistemological overlap than we might consider than what is felt in a practice moment, perhaps.
Exactly.
Yeah, thanks. And I'm mindful that in the bio, it seems like I know you're in the supervisor role, kind of bridging the worlds, but a couple of you are in the crisis world, or maybe on the other side.
Yeah, so I can answer that. Um, so with our project that we do, which is research, we are right in the crisis world. So we do interview responders, for example, and stakeholders who work with ethnoculturally diverse individuals, as well as ethnoculturally diverse individuals who are in crisis. And so we do hear a lot of those intersecting kind of challenges that aren't necessarily looked at within mental health, within the crisis world. So not understanding sometimes those language barriers in terms of how that impacts individuals. And so not enough services that do have the same language. For example, there's a lot of isolation, culture shock, for example, that occurs as well, and racism as well. And so I'll just kind of throw out some statistics in Canada, but there's 51% of racialized individuals over the age of 15 report experiencing discrimination. And so and there is a correlation between discrimination and mental health issues as well as
Mm,
suicide risk.
mm,
And so I think that that's really important to recognize is these intersecting factors that we don't always consider, especially on crisis lines, which are predominantly, take that westernized kind of models as well. And also, sorry, I'm going to throw out some other statistics here, but so we also found in the literature that 95% of Black individuals reported that available mental health services are inadequately are not meeting their needs. And so that's,
95%,
yeah, so that's obviously extremely problematic.
almost everyone.
Yeah, when we look in terms of mental health, when we look at crisis kind of situations, and so we are failing, unfortunately, to meet those needs in not only on crisis lines, but in different services as well that address mental health. So very problematic. Well,
Yeah, thanks for sharing that, Tara. And I guess I'm appreciating that, like, as I'm kind of reflecting on it, my original question was a bit individualized, and I'm appreciating that you're kind of speaking to some institutional failures. Because if 95% of folks are saying it doesn't work, that's almost everyone. It's distressing. Okay, I'm kind of just sitting with that. Um, yeah, I'm curious to hear from some of the others too, like how you're kind of making sense of what Monica and Tara are saying, and also some of your own work too.
Yeah. So I actually started research because I was working in a crisis response program that was a new pilot in Calgary, where it was kind of the first of its kind nationally, at least in Canada, where we built our own crisis response system within an immigrant serving agency. And then I was drawn to the work and the research that Monica and Tara were doing at the time. But with these statistics, it's very much seen in the community as well.
Mm-hmm.
Like me hearing this the statistic, I'm not really surprised, to be completely honest, because people are approaching our organizations already with a really high level of mistrust and fear a lot of the times, just based off of previous negative experiences with a lot of the institutions. And so when I'm hearing these things, it's very much seen if you kind of go into our communities and look at them. And I think it's also linked to my personal failure story too, a little bit, where I think my personal failure is coming into this. I'm doing my practicum right now. So my first time exposed to like real clinical work in a therapy room and therapy space.
Mm-hmm.
And I jumped into it trying to be like a good therapist,
Mm-hmm.
Immediately going into risk assessments if I'm hearing suicide, or, sitting across the room from each other, going through a certain framework or modality. But I very quickly realized that with our communities and ethnocultural communities, these things don't really work. Like these things weren't built with these communities in mind. And so I've had to do a lot of unlearning and relearning on the kind of theme of today of relational and systemic responses to care, because a lot of these things are huge barriers. If somebody's disclosing suicide, the last thing that they want to do is go into an immediate safety plan, because almost in my kind of personal experience over the last couple of months is that's almost a test of can I trust you or not to continue to disclose. And if I'm jumping into kind of that like robotic or that very like rule-based protocol, I find that they become a lot more guarded as well. So I can see institutionally why these statistics are so high, but then also being that person who's contributing to this statistic, ultimately, I'm understanding why they're so high on a personal level too.
Yeah, Alam, let me know if I'm kind of capturing or understanding your piece correctly here, that coming from a crisis context and going into maybe a more therapy context, if I could use that word, finding that some of the approaches perhaps from the crisis world that were brought over to the therapy context when they were like kind of used in a moment of crisis. And just to be clear, when we're talking about crisis, we're talking about like mental health kind of crises, like psychiatric crises. Okay.
But the crisis, I think that's the assumption, but crisis response and even in therapy, we don't recognize the structural barriers that contribute to this crisis or this mental health response. So we might be assuming it's a mental health crisis, but we're not looking at those systemic or structural barriers. And then as therapists, we very rarely acknowledge them either. We really we pathologize these issues that are the institutional and systemic level and say it's a mental health issue.
I see.
And that's how the therapist is approaching, and that's how I would approach it in a therapy session. But rarely do we actually, or at least are we encouraged to actually name these structural barriers that are influencing these mental health crises.
Okay, that's really rich. So like ways that institutional failures become defined as personal failures that get interpreted as a mental health issue, and then an individualized bureaucratic robotic thing is delivered that kind of degrades the relationship that would be necessary for the crisis work.
I think you captured that beautifully in a sentence. Yes.
Okay. Yeah. Easier to repeat what someone else is saying. Oh, thanks, Ahlam. I want to check in with you on it too. Curious what you're kind of
For
sitting with.
sure. And I think with what just Aklam just shared, um, I can speak more to that. So, as you said in the beginning, my own practice started in psychiatry, like in the medical model, and that's a very hierarchical, and I'm gonna say like even robotic way to approach crisis intervention or like even different mental health supports, right? How psychiatrists usually go about it,
Mm-hmm.
different than social workers or other therapists. But I was recently reflecting on how I have also contributed to systems that fail culturally diverse clients, especially because I think my own perception of what's fair in an interaction with a client has also been informed by that kind of consistent, standardized service. And maybe that consistency is what I was perceiving as fair. And I'm currently working in the field of sexual violence. We do some crisis work and also connecting them with therapy, like long term. We recently had a client who had an overlap of multiple things that made them vulnerable, like a specific immigration status that put them at risk. Um, they come multiple experiences of trauma, but also a lot of pieces that were putting them at more risk immediately. And something that I noticed back then is that we did have a triage system, but none of those vulnerabilities were included there because those criteria were mostly designed with like the majority, cultural majority in mind, or with clients who maybe understand what's the unimplied communication style that's needed to self-advocate and communicate your needs when you're doing that first assessment with a crisis worker. I remember that we brought this to supervision. We were able to connect the client with services, but at that point, we were having that conversation where when we're noticing that how can we improve systems so we make them more flexible for us to kind of navigate these differences that will come up in diverse societies, such as the one we have here in Calgary, where a lot of the pieces that we may be assuming of a client or we may be familiar with are not present.
Mm-hmm.
Or maybe I'm extending myself here, but what I notice also is maybe a barrier to provide good services to culturally diverse clients is that sometimes we are not informed enough on how legal proceedings, immigration matters are affecting that person's ability to engage with services at all. And what are the resources we are actually able to connect them with?
Yeah, that these big like kind of forces like the judicial system or like the immigration context have effects on folks, and how do maybe therapists or providers kind of incorporate those into their assessments? And I guess if it's okay to ask you a question, and I apologize if I maybe missed something. You were kind of talking about vulnerabilities that were identified in one context, but then you noticed that they weren't being used in the other context. Did I understand that correctly?
Yes, yes, you did. Especially because what I meant is that when most systems are created, a lot of them are borrowing from other areas in medicine, right? Or hospitals, psychiatric criteria. And a lot of the times we're focusing on age or maybe what we understand as immediate risk,
Mm-hmm.
maybe as a current threat that happened recently, or maybe if there is a protective measure in place or let's say a police report in place, things like that, right? Like we have a very Western understanding like what those risks can look like. But with culturally diverse communities, sometimes there are other things that are creating vulnerabilities, but because as practitioners we're unfamiliar with them, we're not able to maybe like appropriately assess for them or even know what to ask. Because it can, as maybe relevant, I am a Latin American, I may have an understanding of some risk that a Latin American client could experience. But I may have a very big blind spot for an Asian community or an African community where I don't know some of the cultural subtleties that are taking
Uh-huh.
place and that maybe are stopping the client from fully telling us the whole story so we can properly help them.
Hmm. Yeah, you're speaking nicely to such a complicated territory when we're like working with diverse clients. I mean, I think we use that word. It's kind of funny that word diverse could be used kind of monolithically or singularly, but we're speaking about a whole kind of global, almost not global, that's the wrong word, just people around the globe experiencing things so differently. So it sounds like the four of you kind of occupy some similar ideologies, but also like very different territories of both the work and kind of professional practice. How did the four of you find each other?
I can respond to that. So first, I think one thing that we share in common is we are all affiliated with the University of Calgary and the Faculty of Social Work, either and as students, instructors, trainers, like supervisors. So we are all connected with that. The other piece is, I think, and that our faculty, the Faculty of Social Work, is trying to move from research that is highly focused on the interest of the researcher and most about researchers and at any level, and research assistants, co-applicants, primary investigators, but all the people who is doing research, putting our research skills, time, and energy to the service of the community. So one thing that interests and us and other members of our team that are not here today is we are highly interested in transforming the crisis response field. And so we have been approaching partners, like, for example, in Calgary, we have partnered with the Distress Center Calgary. And we approach these partners also with other partners like YW Calgary, who focuses on interpersonal, domestic violence, gender-based violence, and with other partners. But what we do is usually we try with the idea of improving the life of Calgarians, Albertans, Canadians, and maybe inspiring other people around the world. And what we do is with this interest in transforming crisis response, we approach and then we say, how can we put our research skills at your service? And then in doing participatory community research, and the things that are more concerning surface, like, for example, and Distress Center Calgary telling us we want to do better for ethnoculturally diverse clients. We want to do better with the 2S LGBTQ plus communities, because one of the things they know, and we know for research literature, but they also know as agencies or organizations in the community, is that most of the people who call crisis lines might be, for example, white people versus racialized people or other people with other ethnocultural diverse identities. So these communities do not reach out. They might not call, or just a few of them. Or in the case of Canada, when someone calls and English is not their first language, they might be waiting. I will not tell, but could be from 20 minutes to 2 hours for them to find the translator to be able to support them on the line.
Yeah.
At the same time, and we have partners that offer long-term therapy. And one of the things, for example, Aglam knows a lot about this, and other members of our team, is that when immigrants and refugees and all newcomers in general, for example, in Calgary, reach out to, they need support with mental health therapy, counseling, or these mental health services, they usually might not reach out to, for example, Alberta Health Services. They might not reach out to Recovery Alberta. They might not reach out to the Distress Center. They will connect first with the settlement agencies. And settlement agencies in the past, they used to offer English lessons and legal advice and these kind of things, how to get your Alberta, like system navigation, how to get your health card. But now many of these settlement agencies, or I think all of them, have been moving from system navigation as a newcomer to offering mental health services and counseling, even some of them are starting their own crisis lines because they know that, as Anna will saying, we have failed newcomers in Canada when it comes to either therapy services, mental health services, and crisis lines. I don't know if Aglam, do you want to share more on this?
Yeah, and I think it's interesting because this is something that I think about a lot because in working in a lot of the immigrant serving agencies in Calgary, we've become like a hub for holistic care. And so we'll see that other organizations might not be addressing a certain aspect of care in the best way possible or the most responsive way possible. And so we will apply for funding, get the grant, and then actually develop that ourselves. But kind of where I'm in the middle is like, where's the balance, or when do we stop doing that and actually move towards building the capacity of the existing organizations? Because why are they not able to adequately care for a really big part of the population in Canada at the end of the day? Because it goes beyond immigrants and refugees. It's a lot of different ethnoculturally diverse communities who aren't feeling, and even like looking at the statistic of 95% of Black people, that's not specific to just refugees and immigrants. So you're looking at a huge part of the population who does not feel trustful in the existing institutions. And then you have immigrant serving agencies on a smaller scale developing a program to address this. And so that's why I'm really enjoying the research part of this, is because we can go to those organizations and say, these are the gaps in services. Let us help you build your capacity. And so, yeah, I do agree with kind of what Monica's saying very strongly too. But I do think about a lot of like, why do we have to keep creating these programs instead of building the capacity for these existing systems who do have the funding already? Because in nonprofit, lots of things are limited, right? And so we're already working with very little resources, but we just keep expanding. And I think another thing too is because in immigrant serving agencies, you naturally are relational because your staff is more diverse a lot of the time, where you like your programs become a lot more culturally responsive just based off of even who's applying for the applications. Right. But even then the communities are picking up on this, and then they'll even find like trustful social workers or settlement workers. So like a lot of my clients are people who are like, hey, I heard that from this person that you've helped that you're great at doing 1, 2, 3. And so the community will also figure out who to trust and who not to trust. And so if you're not getting these communities coming to you, that's an easy way of just saying like, we're doing something wrong, because the communities will talk to each other and they will kind of develop their own resource navigation systems themselves too.
Can I just add to that really quick as well? And actually in some of our research and talking to different individuals, that's actually what came out is as soon as a crisis service or a service has a bad reputation within the community, then people will not access it. So even one person, if they have a bad experience and they share that, then that's essentially it. They won't access those services. And so, yeah, that's another reason to really reach out sometimes to the communities, as well as make sure that the services are adequately meeting the individual's needs. So,
yeah. I'm really appreciating this conversation. So full disclosures, a lot of what you're sharing is like really connecting with my own experience. I'm here in San Diego, in California, United States, and I work at a nonprofit called License to Freedom, where we work with Middle Eastern refugees experiencing domestic violence. And one thing that stands out to me, Ahlam, I really appreciate this piece that you're speaking to about this balance of kind of noticing either a lack of services or maybe a service that's being delivered but not well or adequately, however that's kind of assessed, and then this balance of developed in practice, or the kind of the service ourselves, like within the resettlement agency, which I think is kind of the first place of familiarity for when refugees arrive, to building the capacity of an existing agency or service. And that feels like a really maybe minor on the service, but kind of a profound way to push back against the very neoliberal market of nonprofit agencies. Because I always kind of joke that the best nonprofit agency isn't the one with the best services, it's the one with the best grant writer. And so there's like this kind of competition for funds that outweighs, well, the community, attention to the community and what the community needs. And then, Tara, this piece about a bad experience that folks might have with a service agency and the ways that like ripples through a community and people are like, I was just thinking like that's just such a challenging territory. I'm just curious how that's approached, especially because as you guys were talking about, like kind of developing research to support training for folks who are working with diverse communities that aren't necessarily your own community at times. And then how that intersects with like broader political movements too. And I realize I'm asking a massive question, so you can pick up on this wherever you want. But I don't know. One of the experiences I have at our agency is that providing services for domestic violence, sometimes I've heard clients or community members identify us as the place you go to get divorces, or that's the place that divorces people, which is definitely not what we're trying to do, but is a result of some of the work we necessarily have to do, if that makes sense. So it's kind of like these reputational things or legacies that follow us because of the nature of the work. Um, I don't know. So I'm just kind of like just sharing all the ways that I'm feeling really connected to what you're saying and wondering, yeah, if there's pieces of that maybe you want to pick up on or respond to, or
I think I can talk on the last piece you were mentioning about how like culturally diverse communities perceive the outcome, right? Whether that's a divorce or a legal proceeding or sometimes a mandated report, like many things that can come through crisis intervention. And what I've observed is that at the end of the day, the best results don't necessarily come from them working with someone with the same cultural background, but working with someone who's bringing that cultural humility and a good sensitive approach to be honest about what they don't know and ask for context so they can understand where the client is coming from, like emotionally, spiritually, intellectually, but also I don't know, maybe upholding that self-determination, because what I've seen here, as I told you, coming from Latin America, is that there are inherent differences between collectivist cultures and how individualistic societies are here. Sometimes the way was like a therapist that grew up in North America and the solutions they perceive as the best options are not really aligned with what the culturally diverse client is prioritizing, or something that will even be feasible with their family structure. So I think that's something that comes up pretty frequently in this kind of service that we're providing, and the research, of course. But definitely, I think a piece that can be worked through trainings for providers is just how to approach those conversations, how to get that information, and also how to navigate that balance of keeping the client safe, but also allowing them to keep their autonomy to decide what they want their life to look like and their dynamics to look like.
let me know if this is fair capture what you're saying, Anna, that maybe it's the trainings are less focused on some protocol driven movements towards an outcome versus like some ways that folks can be in relationship with each other that's useful.
Yeah, I can speak to that too. And so we recently see, I think December and also this month or January, we were surprised by this thing. We thought we were writing papers to publish about our research, but then we also thought, like, instead of just writing these papers that will maybe reach out to a very few scholar people, let's transform everything that we have learned into training for the community. So with these critical lenses, that is not, we will not offer assist or rovers like the regular crisis response. We will infuse with what we are doing relational, not focus on the individual in distress, but this systemic lens and from the colonial frameworks. So we created 2 trainings, and one on how to support people in crisis from culturally diverse communities, and other for how to support people and 2S LGBTQ. So the first training we offered in person. It was over capacity for 80 people. And it was most people, you will assume, that works in therapy. They might have the skills, the tools, the training to support crisis. If you work in crisis intervention, of course, you are expert. You have the tools, the training, etc. Right? So we were thinking, we also offer lunch. We thought like, we will have all the food. Nobody will come. That day was very snowy, very cold. And we were thinking, we will open the training. It was sold out in, I think, 24 hours. So we started to see and come and train about transforming crisis response from these lenses, and in 24 hours sold out. Wow. The day it was we delivered the training, we thought because of the weather conditions nobody will come, and everybody came. Even people who didn't register, they show up. I don't have a ticket, but can I take your training? People came. Then we offer the same and virtual, because we thought, it was so successful the in-person. We thought maybe virtual is better, so we have capacity for more. So instead of 80, we will invite 100. So we opened in 48 hours, the 100 tickets were gone. And then we thought because it's virtual, it opened to, 150, then 200, then 250. So we have 150 registered people interested. And that was very surprising, because the training was not about the traditional crisis response, and it was open to therapists, counselors, psychiatrists, family doctors, to any people supporting people in the mental health system. And we have many agencies represented. And so it has been very interesting. We think even the people, most of them might feel equipped to support interpersonal violence, gender-based violence, sexual violence, suicide, self-harm, etc., crisis. They came, and so it seems people is really thinking, I need to continue reflecting on this, learning about this, being in conversation about this. And it was great. We have many groups being in conversation, coming back to the main group, sharing what they think. And it has been very generative. I think many people has been feeling they are failing, and they really want to do better, and they want to be in conversation about this and improve their services they are offering.
Wow. Well, congratulations. That's incredible. I'm in some ways not surprised to hear that, because I think it's been 50 years of kind of the same type of stuff around some of those conversations, around kind of protocol-driven, liability-centered, very dry approaches. And I'm also, as a San Diegan, if it rains here, no one's leaving the house. So the fact that people are doing anything in the snow always stands out to me. So that's, wow, congratulations. Ahlam, yeah.
Yes. Oh, sorry. I just kind of want to link what Anna and Monica were saying to what Tara was saying, where you then responded with that 2 kind of parter question of people just don't know. So people don't know these things, community don't know these things. And so to kind of be more specific to that instead of just super vague, of even when you were saying about the community in response to Tara's question of how do you address communities, once there's a bad reputation, is to actually go into the community. So even when you were talking about with your work, how people just assume this is the place where people go to get a divorce. And it's because they don't know, and we're not taking the time as social services around the world, or at least in Western countries, to actually go into the communities, build the trust, and educate them, right? We're the ones who are holding the knowledge, and we're just assuming that this is common knowledge when it's not. And then the second piece is that political piece you were talking about and I've noticed this, and I think that's why it was so successful, like this training, was because we actually just addressed the politicization of being human in this training of, you can't, I know when I was doing my BSW, there was a really strong push for like the personal is not political. And now in my MSW, there's a big push for the personal is political. And so kind of being allowed now to almost just address it head on. And that crisis response, there's a politicization of certain elements in there too. Ethnocultural communities, just being somebody who identifies as an ethnocultural person, there's politics involved there. And so I think that people are just craving that in our communities of like when we're talking about therapy and we're talking about crisis response and we're talking about why it's not working for certain communities, you need to address the political aspects of it too. You can't remain neutral in these cases.
Right.
And I think that that's why these events have been really successful, is because then we're actually talking about why are they not working and getting into the things that people in these big agencies who are getting funding and these grants and stuff, they might not be able to say, or the frontline workers who might be fearful of kind of the protocols and policies. And we're in a very unique space as researchers where we are able to address those things and then also give the strategies to actually implement them in practice. And so I think that that's like a big thing, like a reason why we've been really successful in this work is because we have that personal experiences too, and those lived experiences of what it's like to feel like an organization or a system wasn't built with you in mind, but then also being able to go into the communities, get their feedback and compile them into these community-based sessions and trainings.
Yeah. Wow, lovely. I mean, your work is so important, and I'm so thrilled that you're finding success in it because it seems really important. And I'm also happy that the community is responding to it and connecting with it. So yeah, I'm really grateful for you all for joining me today. And I feel like I'm just in the middle of this conversation with you guys. So I hope that maybe if it feels appropriate to you, or there's an invitation to come back because I'd love to continue this conversation. If folks want to kind of follow up with your work or kind of learn more, where might they go?
If they want to know more about our work, we have a website. And if they Google the Stress Center Calgary Knowledge Hub, and they will go to the University of Calgary main website, and they will find us there.
Okay.
And yeah, and we are called the Stress Center Calgary Knowledge Hub because the Stress Center is our main partner in trying to innovate in crisis response, and also Knowledge Hub because what we are trying is, as you were saying, connect with people who is interested in this, to be in conversation and relationship, to explore, expand, enhance ideas together. So we are just, as the Knowledge Hub says, like a group of people just trying to know better and connect everybody who is interested in these ideas.
I think also, if you don't mind me interjecting here, we do have training as well on February 28th that's online. And so, yeah, and we, for the last training, we had people come from, well, not come, but attend from Mexico, the States. We had all over Canada. And so, yeah, we'd love to see people out there as well. I believe Monica's phone number is on the site as well. To contact her. We're also still looking for individuals who are ethnoculturally diverse and who have experienced crisis to take part in our study. And we do offer a small gift card for that as well. And so unfortunately, they can only be from Canada at this point. But yeah, we'd love to hear their voices to be able to make those systemic kind of changes. So.
Lovely. Great. You might see me pop up in the training or maybe giving you a call, Monica. Very brave to have your phone number on the side. Wow. Okay, well, thank you for so much. Appreciate your kind of joining us and sharing your work and the heart that you put in the work.
Thank you, Navid and AFTA for the invitation to share about our work together.
Of course.
Yeah,
Thank you so
you.
much.
Thanks.